All right. Well, we are going to start our webinar tonight. I'm Karen. I'm your Zoom host, and tonight we have Dr. Badali, who will be presenting mental health and learning differences during the COVID-19 pandemic. Dr. Badali has expertise providing neuropsychological evaluations to individuals across a broad age range, from preschool-age children to young adults. She has worked with individuals who have a wide variety of developmental, learning, and psychiatric concerns. She has served in specialty clinics for children with autism, spectrum disorder, and attention deficit hyperactivity disorder. Dr. Badali strives to conduct comprehensive evaluations to best understand each child's strengths and weaknesses. She relies on up-to-date research findings to identify appropriate interventions to optimize academic, social, and emotional functioning. And she endeavors to work collaboratively with educators and service providers to ensure that children have access to needed support. So without any further ado, go ahead, Dr. Badali, you have the floor.
Well, thank you so much for the introduction. So today, like Karen mentioned, we're going to be talking about mental health and learning differences during the COVID-19 pandemic, with a strong focus on how to help with mental health challenges. So I thought I'd start off and just talk a little bit about what learning has been like during the COVID-19 pandemic. So to start off, we want to acknowledge that the COVID-19 pandemic has had a direct impact on children's education, and that impact hasn't been identical for all children. So there's been differences, for example, in the degree to which students have had school closures. Even within the same country like Canada, there's been differences as seen here from data through March 2021. There's differences in the technology that's been available to kids so that they could access education when there have been school closures. And beyond that, we can also think about changes to how in-person education has been delivered when we've had physical distancing in class, how there might have been changes in teaching personnel when educators might have fallen in, and then a number of other variables. So just there's been a lot of educational changes. In the context of these changes, it's not surprising many parents have been concerned about their kids' academic progress. And in fact, the majority of parents, according to one survey from the US, showed that parents were concerned. So in the fall of 2020, following that initial period of school closures around the world, most estimates suggested that students lagged several months in their educational progress compared to expectations. In particular, data suggests that students weren't making expected gains in math as compared to reading. And I'll note that I'm using the word lag. You often hear people instead talk about learning loss, but I think lag is better because students typically didn't regress, they just didn't make quite the same rate of gains that you would have expected them to. And I'll also just acknowledge that we're talking here about averages and that individual children will have had different trajectories. So then what about during that 2020-2021 school year? So not only does data suggest that children maintain their learning lags, but the average student's lag actually increased. And here we're using the example of data from the United States, but pretty similar findings have been found in different countries. And data suggests that vulnerable communities, for instance, those who have less financial means, have been disproportionately impacted. So I also wanted to highlight that the impact of the pandemic wasn't just on student achievement, but also student attendance in school. And now people are thinking about, well, what's the long-term impact? And researchers expect that there will be some continued effect of pandemic closures and changes in education, albeit not from the same degree to all. So this is one example of a study that tried to estimate what would be those long-term effects, and particularly thinking about closures of early childhood education centers. And happily, Canada is one of those countries where they think there might be more minimal impact by adolescents compared to some others. So then what about children who specifically have attentional and learning challenges? Well, there's been fewer studies that have looked just at them. Here's a handful of summaries of studies from one recent review paper that did actually look at children who had attentional and learning challenges. And overall, the data says they probably have more manifestations of their problems, meaning kids with ADHD probably had greater ADHD symptoms, so they might have had more trouble focusing on lessons, turning in homework, but they didn't necessarily have trouble gaining the basic skills any more so than other kids in the class, versus kids who do have learning disorders probably had more trouble learning those skills that are already hard for them to learn. So there really was an exacerbation of problems, at least from the data that we have and can tell from. So now let's think a little bit about mental health in the pandemic. And I just wanted to start off and acknowledge, well, why did I even review the academic impact of the pandemic if really the talk is about mental health? And that's because if you're struggling in school, that creates stress for kids. And children who have attentional and learning challenges, they're going to face that base level of stress because of their difficulties. And then the pandemic comes in, makes everything more difficult, and now they're getting a higher level of stress. And the concern becomes, is their level of stress going from stress to distress, meaning that it's just too much to handle? And I'll note that the pandemic has created lots of other stresses beyond just that academic piece that I covered. So it could be not having the same access to friends, being worried that mom and dad might get sick, or even that you might get sick. It could be now everyone's kind of working from home and we have this small space and we're all on top of each other. But particularly for kids who have those learning and attention challenges, thinking about that additional academic stress, I think, is really important. So what about the in general findings that are out there? In general, research has found that children rate their quality of life lower as a result of the pandemic. They have more physical symptoms of stress, things like headaches and stomach aches. And they also have more emotional distress. So this is actually a survey that was conducted by the Child Mind Institute, so my institute, and they found that after that about first year of the pandemic, about 37% of adolescents reported, my mental health is worse than before the pandemic. And the areas that they were highlighting is that they're feeling more anxious, they're feeling more depressed. And so what about those kids with learning and attention challenges? Is it the same for them? Are we seeing something different? And first we have to just acknowledge, well, what's the baseline for them? Well, they're already at risk. So we know, for instance, that kids who have reading disorders, they're going to be at a higher risk for things like behavioral problems, depression, and anxiety. For kids who have ADHD, just having ADHD is actually the smaller portion. Most kids who have ADHD have at least one other thing that they're struggling with. So at the base, they already have a higher rate of things like emotional concerns, behavioral concerns. So now we add on the pandemic, and what do we see? We see that there's an increase, for instance, for kids who have reading disorders, in the anxiety, the depression that they're reporting. There's an increase in what their parents are seeing in terms of their emotional symptoms and their behavioral symptoms. And very similarly for kids who have ADHD, them and their parents are actually reporting high rates of different types of manifestations of distress in the context of the pandemic. Okay, so hopefully at this point you guys will have thought, okay, well, now I know that the pandemic created more stressors because of those changes, particularly in the academic realm. I know the kids who have learning and attentional challenges at the base have a higher risk for some of these mental health challenges. That's probably exacerbated then afterwards with the pandemic. So now, what do I need to be watching out for? So what are some general signs of anxiety? So kids might do things like they express worries, like, I don't know what's going to happen tomorrow. Maybe the teacher's going to yell at me. Am I going to be okay? They could avoid certain activities, like maybe they don't want to go to school. It could be grumpy, irritable, defiant. Sometimes we just see those behaviors and we think, oh, it's a bad behavior, but it's really a sign of something. They could actually be sad and crying, but it's a manifestation of anxiety. They could have changes in their sleep and appetite, report nightmares, complain of stomach aches and headaches, and even show more unusual behaviors like nail biting, hair pulling. Even sometimes kids will pull out their eyebrows or their eyelashes because they're just so stressed out. So what are some different types of anxiety problems? So separation anxiety, that's when kids are really worried about being away from their caregivers. So for instance, drop off with little kids may be extremely difficult. Some kids have phobias. A big one can be a fear of needles, which when we're getting our vaccines, that could have been a really big one that kids were facing recently. School refusal. So about 2 to 5% of kids, just at baseline before even the pandemic, show anxiety-related school refusal. And this is this intense fear or avoidance of school. So what might be some signs? Well, kids are having tantrums when heading to school because they don't want to go. They might find reasons to get out of school, like they frequently go to the nurse and you have to come pick them up. Social anxiety. This is a lot of that worry about how you are going to be seen by others. So kids might avoid speaking in class because they don't want to be evaluated when they're speaking. They might avoid eating lunch in the cafeteria and go to the school library or the restroom to eat so that they don't have to worry about other people judging them while they're eating. They might avoid going to parties or play dates or other social activities. Selective mutism is a condition where kids have difficulty speaking in situations where speaking is expected. So they have the skill, they can definitely speak. It's not that they have a language problem, but you see that they're struggling to communicate in certain situations. And they need help because that's manifestation of their anxiety in those situations. More generalized anxiety we describe as you have a lot of anxiety and worry and you feel like you can't control it. So these are kids who you might notice are worrying about everything. They're perfectionists with their homework. So to the point not where they're just getting good grades, but then they're really worried about the 1 or 2 points that they missed and you're really happy with their grades, or they're spending hours agonizing over homework that's really quite good. And they might seek out a lot of reassurance because they have so many worries. Kids can also have panic attacks. So panic attacks are those sudden, really intense and unexpected physical symptoms of anxiety. So kids may say to you, it felt like I was dying, it felt like I was having a heart attack. What about depression? So some signs of depression could be saying that you're feeling sad or hopeless. But in kids and adolescents, it's really important to remember that depression often looks like irritable. So it's kids that are maybe they're grumpy, they're cranky. Kids might not want to do the things that they usually enjoy. So maybe they love drawing, but now they won't draw. You see changes in their eating and sleeping patterns, changes in their energy, like they're tired and sluggish, or maybe they're tense and restless. They can have a really hard time paying attention or making decisions. So that makes schoolwork even harder. They might describe feeling worthless, useless, or guilty. And at the extreme, you can see that some kids and teenagers might show self-injury or suicidal thoughts and behaviors. One of the things I always like to reassure people is if a kid says that they don't want to be living anymore, that has to be taken really seriously. That's a sign that they're in a lot of distress, but doesn't necessarily mean that they're going to go out and hurt themselves. So we want to not overreact. We do want to take that seriously and help them, but not overreact thinking the worst immediately. What are some other kind of more general things that aren't really related to more of what are the symptoms of depression, but just kind of the way it might manifest in your day-to-day life? Well, a sudden drop in a kid's academic performance could be a sign. Having a lot of trouble getting motivated on things like starting schoolwork, I mean, that used to not be a problem. Refusing to do things, or that sense of apathy, is kind of like the extreme of low motivation. Increasing lateness or absences because they can't get themselves motivated again. A lot of withdrawal from things, withdrawal from activities, withdrawal from friends and family, that crankiness and grumpiness I talked about. But also even kind of like the things that are really aversive, like saying mean things or being oppositional, that can be a sign that a kid is really feeling depressed. If they're slower than usual, they're more fatigued than usual. Maybe they're making a lot of like negative comments about themselves or negative comments about the world around them. And then another kind of big area beyond anxiety and depression to think about for kids is what are some signs of behavior problems? So behavior problems are often a sign of an underlying issue. And you really want to address that underlying issue, because you could have a behavioral problem because the kid is really anxious about things, because they're really sad about things, because they're being asked to do something that's out of their capacity. But the behavior problem itself often needs strategies to be targeted. And so what are some examples of those behavior problems that you might target? Things like disrespectful behavior, like name calling, throwing things, mocking; defiant behavior, like refusing to do homework and chores; or dangerous behavior, like hitting siblings. So now that we've identified, you should have in mind, okay, well, now I'm thinking those are some of the signs that I need to do something. You're probably asking yourself, well, what do I do to actually help? So the first thing, you want to reduce the stressors in the kid's life, if at all possible. So if we know, for instance, that academic challenges are causing a lot of stress, let's support that kid's functioning along with their social emotional health. So what are some things just for those struggling students? And before I get to that, let me just say the caveat of these tips are not to replace the academic interventions or the medical interventions the kids who have learning disorders or ADHD might need. These are kind of the alongside tips just to help out. So the first is we want to be specific about what a child's challenges or needs are. So for instance, let's take a kid who's struggling to read. We want to give them books at their level. Maybe we give them a visual depiction of graded instructions, so we're not creating extra frustration for them. A kid who's struggling with organization, let's help them get things in place before the school year starts or the new semester starts, or during the winter breaks for after the winter break. If your child is prone to misplacing things, have backups. This way, when it happens, it's not as bad. If they're easily overwhelmed by large projects, we'll help them break things down, make a plan to make it more manageable. And for those kids who might have a hard time sitting still, maybe a wiggle seat or something else that might be recommended by a therapy provider or teacher could be helpful. So those are kind of like the preparation things, but then there's what if it doesn't go as planned? Well, if it doesn't go as planned, discuss with your child, like, okay, if you fall behind or you miss an assignment, what are some things that we can do instead to make it better? Like, could we catch up a little bit over the weekend? Can we catch up a little bit over the holidays? Can we check in with the teacher? Maybe some things don't actually need to get done. Address avoidance. So setting up regular check-ins and giving positive feedback so that, if there is a chance that your kid might be avoiding really difficult things, you're actually catching it proactively. Emphasize that turning something in is always better than nothing, and help your child learn how to manage mistakes in a healthy way. A few other tips. So keeping expectations realistic. If you know something's hard for a kid, don't expect them to be doing it perfectly or even the same way all the other kids are doing. Expect for their level. Avoiding pushing kids with things that might come off as critical, like, did you turn in your report? How about instead, how was your school day? Avoid making school a competitive sport where you're over focusing on grades. In fact, this is actually just a good thing for all kids. We really want to focus more on the effort that kids put into their work rather than the fixed outcome, because the effort is something you have control over. There's factors beyond your effort that go into that fixed outcome that you might have control over. So if you're focusing on the things that you have control over, you're helping your kids grow to be able to persevere with challenges. So those are those tips for just kind of how we reduce that academic stress by reducing some of the extra frustrations that might happen. But what about actually coping with that emotional distress that they might feel? So there's a few general strategies that are good for whether the emotional distress is anxiety, whether it's depression, just kind of across the board good strategies. The first is we want to listen to a child's thoughts and feelings with empathy. So first, we want to ask them open-ended questions. This actually gives them a chance to talk rather than a leading question. Like if you said, do you feel anxious on your exam? Your kid only has the option of saying yes or no versus how are you feeling about your exams? Well, then they have the option of saying, feeling really great. I think I'm going to do fantastic, or I'm really anxious about it, or I'm so sad because I think that I'm going to fail. When you're listening with empathy, there's a few things that you want to do. You want to give the kid your full attention, reflect back what they're saying so they know that you've heard them, and make sure that they know that you understand how important what they're saying is. So the reverse would be if we minimize a kid's feelings. So we say it's not really that important. Well, to them, it feels really important. And then they're just going to feel shame that to them it's important and you're saying it's not. We actually sometimes can even shame directly, and we don't want to do that. And you know, as a parent, you really want to help kids right away. And sometimes you first have to listen before jumping in. So jumping in can actually be more problematic because it feels to the kid like you haven't actually listened to them. Like they should have just right away known what the thing to do was. So first we listen to kids and we make sure they know that we heard them and we know how important what they're saying is. So once we've listened and the child is ready, that's when we can start helping them with things like reframing how they view stressors. Like, I'm never going to do well on my math test. Well, maybe you might do well. Or helping them problem solve through anticipated barriers. So my teacher is definitely going to be mad at me about this thing. Okay, well, maybe she will be mad about this because it's you didn't turn in your homework, but is there something that we can proactively do to help with this situation? Maybe we can send her an email in advance to let her know that we're struggling with this. Maybe we can tell her the plan of how we're going to address this problem. Then let's think about more specific tips for those areas of emotional distress. We'll start with anxiety and then move on to more of those kind of depressed feelings. So with anxiety, we really want to reinforce approaching the issue rather than just avoiding what's going on. And it really is hard to resist that temptation to just accommodate the anxiety, but it is very helpful in the end. You can do things like practicing breathing exercise and other ways to reduce stress, and I'll talk a little bit more about those later. And just in general, just modeling to kids healthy ways of dealing with stress can be really powerful. So if you have a really stressful time when you're feeling anxious and you verbalize to your child how you dealt with it in a positive way, that actually shows them a strategy that later they can use. What about for kids who specifically have more of that separation anxiety? Well, we want to practice that separation in small increments over time. This gives them the chance to see it's not that scary. That's that, practicing the approach versus the avoidance. We can do things like setting up a predictable drop-off routine so it's not as anxiety-provoking, having coordinated playing with teachers, not having a stressful environment in the morning, so we're getting ready without fuss or rush, and no drawn out goodbyes, because if the kid sees that you're in distress, they're going to feel distressed too. What about for school refusal? And obviously this is a big problem. So these are just this kind of little strategies that might help. But first, let's involve the kids, especially if they're a little older and can identify some of the things that are going on in the school, to figure out what are some strategies that'll help them approach rather than avoid. We have to still be firm, although we're empathetic to the difficulty, that school is a must. Providing them psychoeducation. So for instance, if they're having panic attacks going into school, explaining to them how it's really unpleasant, it feels awful, but it's not dangerous. And the last is really important, staying home boring. So if when you refuse to go to school, you get to stay home and have ice cream and play with mom and maybe watch TV, you're going to keep wanting to do that, versus if staying at home means you're just doing all the work you would do in school, it's not as reinforcing. A few don'ts in terms of helping with school refusal. We don't ever want to physically force, emotionally blackmail kids to go to school. That doesn't help in the end. We don't want to make promises about going to school, like nothing bad is ever going to happen. No one's going to make fun of you. It might happen. Instead, we would tell them, we're going to talk about some strategies to help you for if things go wrong. And we don't want to amplify our kids' stress by ourselves getting upset about those little things that can go wrong in school. What about for more of the socially anxious kid? Well, we want to, again, that approach versus avoid. So gently encouraging them to engage in social situations. We are not forcing them. We're going to present it at the level that they can handle and present it a little bit more and a little bit more and a little bit more over time. You can actually practice tackling scary situations. Even if you're not going to it, just like what would you do, kind of mentally practicing for those situations. If your kid does something that usually makes them anxious, acknowledging their bravery with a lot of praise is helpful. Thinking through the worries that they have, because once they have a chance to think through their worries, they might see that the worries are too big. And we want to avoid kind of accommodating the anxiety in the sense of like, we don't want to speak for kids because then they never have to have that experience. And we don't want to criticize a child or be negative about them because now we're making them feel worse about something that's hard for them and giving them less motivation to try. And what about then for those kids who are feeling more depressed? We want to create as much positivity as possible. So spending quality time with them, encouraging them to engage in activities that give them a sense of accomplishment, pleasure, fun, social connection, again, without forcing them, without bullying them into it, just encouraging them. Working together to come up with plans that'll help them feel more engaged. And we wanted to help them avoid those big negative thoughts that might be coming up for them. And then again, thinking about more of that positivity, focusing on gratitude. And what about that third big area that I mentioned, more of the behavioral concerns? So what are some easy things to be done at home? So developing clear home rules and routines for key tasks, having effective instruction. So what's an effective instruction? It should be brief, one step at a time, clear, should tell you the information, what to do rather than focusing on what you're not supposed to do. And you might even consider something visual to help. So what's an example? If I say, no jumping on the couch, well, fortunately, that leaves me, well, what can I do? How about we can sit quietly on the couch with our hands by our side. Well, okay, now I know what to do. That's a little easier to do. So if there's this experiment they did, and I forget what the animal was, but let's say it's a white elephant. So we say, don't think of a white elephant, don't think of a white elephant, don't think of a white elephant, right? What is everyone thinking about? Oh, white elephant. It's really hard to stop that versus if I said to you, think of a bunny, it's easier to just think of a bunny. So what's a way of making things more visual? So there's kind of a clear prompt of what to do. So visual checklists can be really helpful for kids who are struggling to do all the things that they're being asked to do. So for instance, having a morning routine schedule, an afternoon routine schedule. We want to help promote a kid's more adaptive behaviors, the things that we want to see. So we want to provide opportunities for positive attention, praise the really good things, and maybe even establish rewards for target behaviors. So what's positive attention? So we would be thinking about things like 5 minutes a day with young kids of just like, this is just about you time. We're going to play together. For teens, it might be even a little bit longer, like 10 to 15 minutes, where you're engaging with them, you're doing something that they enjoy. During that time, there's no negativity. So we're just validating their choices and interests. We're giving them positive attention. We're avoiding commands, lots of questions and critical statements. And that helps build kind of the positive foundation for other times when you can't be as positive. So it's that relationship, putting the dollars in the bank kind of idea. We really want to reinforce or praise all of the really good things that you see. So how do you do effective praise? You have to be specific. Like if a kid, what you want them to do is put away their toys and they put away their toys, well, great job putting away your Legos. You want to be consistent. So it's not once in a while and you don't know when mom and dad are going to notice, but you really try and catch the times when the things that you want to see happen more are happening. You're going to be sincere. Kids will figure out if you're being fake. You want to try and do it as quickly as possible afterwards, because praise is more effective that way. And then also physically close to the kid. Nonverbal reinforcers like a smile, a high five can be helpful. And again, focusing on the things that you want to see more of. So sometimes you've got in your mind like, well, I know what I don't want to see. Really, we're saying praise the things you want to see. So really have to think of what's a positive opposite. And so, for instance, if a kid is hitting, being safe with your hands might be the way we frame it as a positive opposite. If they're whining, talking like a big boy. We want to use consequences more sparingly. They should be logical, immediate, and consistent. So for instance, let's say that you didn't put away your Legos, and now the consequences for the next 2 months, you don't get to play with your Legos. That's not necessarily that logical. It seems disproportionate to what happened. And we will, this is very strongly emphasized, corporal punishment does not help. In fact, it will only create more negative outcomes in the long term. So those are kind of like those big 3 areas of mental health challenges that I kind of previewed at the start. So anxiety, depression, behavior problems. What are some like really general tips in terms of helping? But something that's often disrupted for kids when they're either emotionally or behaviorally dysregulated is sleep. And so I also really wanted to highlight some just good strategies for sleep. Having bedrooms be a good place for sleep is key. So a cool, dark, comfortable place. Beds should be for sleep. They're not for playing video games. They're not for doing homework. We want to avoid all the things that are activating right before bed. So caffeine, like in soda, meals immediately before bed, screen time immediately before bed. And these are actually good for us adults too. They're not just for kids. Consistency is really key to having good sleep hygiene. So setting bedtimes and wake up times that are consistent throughout the week, including that weekend time. If we get into this pattern where we're going to bed really late on the weekends, waking up really late, when Monday comes around, we're still in that pattern, and then we're going to be missing sleep, and it's not going to go well. Having a predictable and relaxing series of events right before bedtime can help get your body in the zone for sleep. But obviously build in some flexibility. So maybe one day you're taking a bath right before bed, and the other you're doing maybe some relaxing breathing exercises, and another day you're reading calmly together. And there might be kind of a set of choices for a kid. If you can't sleep, get out of bed. So if a child is tossing and turning after, let's say, 20 minutes, we're going to get out of bed. We're going to do something that'll help get us sleepy, go back to bed. Still hasn't worked, repeat again. So essentially what we want to do is we don't want to associate the bed with sleeplessness. So we're getting out of bed when we're sleepless. And then making bedtime check-ins short and sweet, because you don't want to activate the kid when they're falling asleep. Let's say a kid is still having more trouble. Well, tracking what's going on with sleep can be a helpful way to then maybe go to the pediatrician or another provider and see, is there something that we can target? Or even you might notice patterns yourself So what are some things you might track, like when you're going to bed, when you're waking up, if there's anything unusual, like big nightmares that happen, what did you do right before bed? Maybe you were doing screen time, maybe you had 3 Coca-Colas. All of those can kind of help you figure out, oh yeah, those are the things that we need to be targeting to make sleep better. And then we might get to a place where you're saying, oh no, we need more intensive help, right? Kind of try these like milder strategies to help with milder kind of stress, anxiety, sad feelings, behavior problems at home, but it's not enough. So we're going to need to call in the big guns, and maybe it's therapy. So for instance, cognitive behavioral therapy is exceptionally effective for anxiety. Kids who have that really dysregulated presentation of depression, or older kids who might have more serious symptoms of depression, like they really don't want to be alive anymore and are making maybe some gestures. Dialectical behavior therapy is very effective. Behavior parent training is wonderful for behavioral concerns in kids. And so with that in mind, I wanted to talk a little bit more about kind of what are some of the more advanced strategies that you might see in some of these treatments. So in cognitive behavioral therapy, kind of one of the underlying principles is that our thoughts, our emotions, and our behaviors are interconnected. So for instance, if I had the thought, I'm going to fail my test, I'm probably going to have the emotion of anxiety. And what's my behavior? Maybe I'm going to avoid the test. So all of these are linked together. And so there's strategies at each of these different levels. At the emotion level, it's really about understanding the emotions. And so emotion monitoring skills can be important. So what would be something we do in terms of emotion monitoring? We'd recur the situation, our dominant emotion, and the emotion intensity. Maybe the situation was, I had to go to a play date. My dominant emotion was fear. My emotion intensity was a 7. Or mom told me to clean up my room. Dominant emotion, anger. Emotion intensity, 10. Or whatever it is. But it helps us kind of figure out a little bit more about what's going on. At the same time, in kind of like a more advanced level, you can also record any body responses and behavioral reactions. And what does that help with? Well, logging that situation tells us what some of the triggers are. And if we know what the triggers are, we can think about how to minimize them if they're minimizable. And if they're not, how to prepare for them. And logging those consequences of the physical response and the behavior gives us an idea of where we might want to target some of our work. Is there a different way that we could respond in preparation for when we feel the way that we expect we might feel again with a trigger? So that was that emotion part of the triangle. What about the thought part of the triangle? So even though sometimes it might feel like it, our thoughts are not facts. They're often automatic. So sometimes we deliberately think things through, but oftentimes we just get a thought that pops into our head. It comes out quick and we don't question it. And while we can have some really helpful thoughts, we can also have some really unhelpful thoughts. So these more negative, self-critical, unrealistic thoughts. So I kind of gave you an example before, but let's work through this again just to kind of have a sense of how this might go. So I have the thought, I'm going to fail this test. I'm never going to get into college. I'm super anxious about all this, feeling even hopeless. And I'm just going to assume defeat. So I'm going to check out. I'm going to procrastinate. I'm not going to study. That's not helpful, right? Then you're probably going to fail that math test. And next time you're going to think the same thing. What if we change the thought? Okay, it's going to be hard, but I'm going to do my best. And it's just one test of many. Even if I don't do well, it's not the end of the day. Still a little anxious, but not as bad. Oh, and now, now I'm more likely to study because I think there's a little bit more hope. So with thoughts, we really want to think about, is there an error or a problem in that thought? One type of error we can make is called black and white thinking. So this is when we see things in extremes. They're either really great or really terrible. There is no middle ground. So I'm either in I'm the best in the world, or I'm going to fail that test. But we're not thinking about, well, I could just do okay. Like maybe if I study my hardest, it won't be the best grade, but I could do okay. Fortune telling. So this is when we think we definitely know the future. So you can see how these can go together, right? Because the example I just gave of black and white thinking of like, it's definitely bad or it's definitely good was about something in the future. So I was also fortune telling there. I was thinking that I knew how things were definitely going to turn out. Like, I can't know. I don't have a crystal ball. Sometimes we ignore the positive information, just focus on the negative information. And sometimes we unnecessarily label things, like we might call ourselves stupid. So unfortunately something I often hear kids say when they're struggling in school, but that's not a helpful thought at all. Sometimes we take things personally. So like, let's imagine another kid said something mean to us. Well, that might say more about the kid than it might about us, but we might take that like it means that there's something inherently wrong with us. Very related to that fortune telling is thinking of just the worst possible outcome and not thinking about all the other possible outcomes. And mind reading would be thinking that we know what somebody is thinking, but maybe it's not as bad. So how do we cure some of those thinking traps, right? This is where cognitive behavioral therapy can really be helpful for kids, because it trains them to catch those thoughts and then come up with those replacement thoughts. So if I think I can't do this, well, we come up with the anti-venom to our snake bite of a negative thought with, I usually can, so why not now? Or I can only focus on trying my best, or even if I can't, it will be okay. So in our triangle, we looked at the emotions, we looked at the thoughts, but what about the behaviors? So oftentimes, one of the things that happens, particularly for feeling depressed, is we'll say, oh, I'll do that thing when I'm feeling better. I don't have the energy, so I'm just not going to do it right now. But that thing that we're putting off, it really makes us happy. It's going to see our friends. It's playing our favorite game. And the thing is, what research tells us is if we do the things that we enjoy, then we feel better. So we actually have to do the things that we enjoy to feel better in life, and we can't wait for our emotions first. So what are some things to think about? So these could be for kids, these could be for adults, but doing something for others, doing something that's fun, that you enjoy, doing something social where you feel connected, doing things where you feel like you have mastery. So for instance, if we take a kid who maybe has a reading disorder, well, they might not get the sense of mastery there because they're comparing themselves to all the other kids, but they might be an exceptional artist. So let's give them that time to do that skill that they really excel at, or maybe they're just the best Lego builder in the world. Let's have them take some time to build Legos and feel good about what they can do. And physical activities can be really helpful. So those are more of the mindset of that cognitive behavioral therapy framework. More dialectical behavior therapy frameworks or mindfulness-based behavior therapy frameworks have a little bit of a different slant, and so they bring a little bit of different strategies for us to think about. So from that framework, there's often this idea that emotions are like these urges that are big and intense, and they cause these big emotions, and we have to just ride the wave and know that the feeling isn't going to last forever. So we just need to tolerate the moment until it gets better. And so there's this category of skills called distress tolerance skills, which is really just about how do we make the situation not worse. We can't solve the problem right now, so let's figure out how we can do something to just manage at the moment. So maybe it's a distracting activity. Maybe it's focusing on helping others. Maybe it's this thinking about how do I push away the negative thoughts. Maybe it's doing something to bring out a positive emotion, or using self-soothing skills. And so what's an activity with that last idea? So creating a self-soothing kit. So for instance, you can get like a small Ziploc bag or a pencil case or a small pouch and fill it with 5 different objects, one for each of your senses, that help you feel calm and relaxed. So this is an example of what you might do with a younger kid, for instance, in elementary school. Maybe something that they can smell, like a good smelling hand lotion, might be put into their little pouch. Maybe something that they can touch, like a stress ball, would be put into the pouch. Maybe something that they can look at, like a small picture of their family, would be put in the pouch, so that when they need that moment of, okay, I'm going to ride the wave, they can pull out their little self-soothing kit to help them out. So in that set of skills and kind of those dialectical behavior therapy frameworks and mindfulness-based therapy frameworks, there's also mindfulness skills. So what is mindfulness? So it's being present and aware in the moment while avoiding judgment. What can we be mindful of? We can be mindful of our feelings. So just noticing the feelings that we have. We can be mindful of our thoughts. So just noticing that you have a negative thought, not necessarily analyzing, but just noticing that it's there. And noticing our body sensations, like I'm hot, my heart is beating fast, my muscles are tensing. It's important to say that noticing isn't the same thing as ruminating on. It's really this act of, oh, it was there, and then you let it go, just like they say in Frozen. And so what can mindfulness be helpful with? It can help you better identify those thoughts, emotions, sensations, and reactions. So if we were thinking about that cognitive behavioral framework where we really need to have a good sense of these things to target them, well, mindfulness can be kind of something that could help you get to that place, because now you're getting a better understanding of what's going on. You can then, it can help us be present with and accept or let go of thoughts and emotions. And really at the end, the goal is to accept the things that we can't change. Because unfortunately, there's a lot of different stressors in life that we have no control over. So when we don't have control over things, we have to find a way to accept them and then instead focus on the things that we do have control over. Now, accept doesn't mean that things are okay, that you like them. Accept really means just living alongside. So what are some ways that we can practice mindfulness? There's a whole set of activities, really almost anything that you would want to do that you can engage in and really think, okay, well, I'm going to focus on noticing it. So I'm just a casual observer, or maybe I'm going to describe what's going on, or I'm going to participate so fully that I'm in that moment. I'm not overtaken by ruminating on thoughts. And so this could be whatever you enjoy: coloring, dancing, going for a walk, but taking that time to actively be mindful when you're doing those activities. Along with mindfulness, we often think about relaxation strategies like belly breathing. So stress and anxiety can result in shallow breathing, and shallow breathing leads to worse anxiety. So if we think of like panic attacks, right, one of the things it often feels like is like, I can't breathe. Well, your body then notices when you're doing these shallow breaths, and it starts this cascade of other symptoms that creates a lot of anxiety. So your body is picking up on that shallow breathing as a thing to tell you that you're feeling anxious. So to counteract that, let's take these big, deep belly breaths to soothe our body and bring it back out of the anxiety framework. So how can you do belly breathing? And there's a ton of different scripts to help you out there. This is just one really easy one. Sit or lie down comfortable. Place one hand on your chest and one on your stomach. Why? Because then you can feel if you're really doing belly breathing or not. Inhale deeply and slowly through your nose and count to 4. And then exhale slowly through your mouth for a count of 4. And then you would repeat for a few counts. And that's helping you just take those nice deep breaths. Another stress reduction strategy that can be really helpful is called progressive muscle relaxation. So again, we get into a comfortable position, and then one at a time, we would tense and release different muscle groups. So you can do things like squeeze the lemon, so you're really squeezing hard, and then you release. And that helps the physical and emotional tension in that moment be released a little bit. Okay, so now you've kind of, you dip your toe into some of these strategies. Where could you learn more? So we have no affiliation. These are just some really nice books that I think could be helpful. Don Huebner has a series of books that cover for younger kids, how do you think through some of those CBT techniques for things like anxiety, like what to do when you rage too much, or irritability, what to do when you grumble too much. Breaking free of child anxiety and OCD is a really parent-focused approach to helping kids who are anxious. And then I also have here a book on some relaxation and stress reduction techniques for younger kids. There's an adult version that can be better suited for like older teens. And there's obviously a ton more books out there. These are just like a couple of the things that might be helpful, but there's so many resources. So now we have kind of a little bit of those strategies from therapies that really focus on anxiety and depression, but what about those behavior problems if you really need to target behavioral problems in more depth? So behavior management techniques, there's a couple of there's even more strategies in this, but these are some core strategies that you'll see in a lot of behavior parent training approaches. So pride skills that I'll explain in a second, redirection, when then statements, active ignoring, and tracking and reinforcing desired behaviors. So pride skills are really 5 different kinds of positive attention: praise, reflection, imitation, description, and enthusiasm. So we talked about praise earlier, so I'm not going to go back over all of those details, but I'll tell you a little bit more about the ride in pride skills. So reflect. Reflections are repeating what a child is saying using the same or similar words. So when you're reflecting what a child says, it has the same meaning as what they said. You might be elaborating on what a kid says. You're really showing them that you've understood them, and you're building a shared language. Imitation is engaging in more of a similar activity as the kid. So what does that mean? Like, imagine your kid is reading for their homework. You might sit next to them and you read your book as well. So they're, and you have more of like a shared, instead of language, more of a shared physical space. Describe is really doing a play-by-play of what your child is doing. So, you might say, you're writing a great story, and what's important there, that the subject of the sentence is your child. Or you made a circle. The verb describes what the child is doing. But if I said, the blocks are piling up, that doesn't work because the child isn't the object. We really want to be describing what the child is doing to give them that positive attention. And enthusiasm with all of this is key. You want to be excited, dynamic, have good eye contact. So smiles and a high energy level, which can be hard when you're really tired, but it does help. And you're really showing that you're engaged, attentive, and interested. So what's redirection? Well, to redirect, you can use all of the pride skills that we just kind of went through. So here's 2 examples. How would you redirect with praise? Well, you'd find something that's positive about your kid's behavior. Like, so let's say a kid is looking out the window instead of listening. You could say, I love how you're sitting nicely in your seat. So you found a way to praise the piece that they're doing well. And now you've got their attention and you can go to the next thing. Or you could redirect with imitate. So what if your kid's being obnoxious and annoying? Well, you want to help model that appropriate behavior, and you can use imitation by taking what they were just doing. So for instance, if a kid was playing with clay and then they start loudly banging on the table, you could say, I'm going to play with my clay gently, like you were just doing a second ago. And the expectation might be that they would want to come back and play alongside you. Obviously, none of these are 100% effective, but these are strategies to try out. When then statements. So when a child continues to be disruptive, even though you've given positive reminders and commands, you might try when then statements. So with when then statements, you're really giving the child responsibility for their behavior. So imagine a kid's whining saying, I want that puzzle. Where's my puzzle? Well, you could say, when you use a big kid voice, then I'll give you a puzzle. Please, can I have a puzzle? Well, that's a great way to ask. Here's the puzzle. So what's this showing the kid? You're telling them very clearly, you need positive behavior and then they get privileges. And then you're also reinforcing that because when they do the thing that you asked, you're actually true to your word and they get the puzzle. What's active ignoring? Well, active ignoring is really based on the concept that negative attention is still attention and it can be highly reinforcing. So imagine, for instance, the kid who at home or in class is just riling everyone up, being a clown, and they're getting yelled at. Well, that yelling, even though you think it's aversive, it's also in some ways reinforcing because it's positive attention. So active ignoring is the practice of giving no attention to obnoxious or annoying behaviors. So when you're ignoring, what do? You have no verbal or nonverbal eye contact. So things like eye rolling, sighing, frowning, those are all at the door. You are just this blank wall. You have a very neutral, bland facial expression. You're silent. And you might be still watching, but from the periphery, no direct eye contact. Again, that would be attention. And then when the child starts acting appropriately, even for a little bit, then you give them lots of attention, lots of labeled praise, because now you're seeing the thing that you want to see more of. So what's some things that you could use active ignoring with? Things like whining, crying, arguing, playing with shoelaces. So what's key about all these examples? They're not dangerous behaviors. Obviously, something dangerous, it can't be ignored, it needs to be addressed. But these are things that are just irritating. They're not going to break anything, they're not going to hurt anyone. So you can choose to ignore those behaviors. Now, one of the things parents always say is, well, aren't things going to get worse? Yeah, initially they'll get worse, but then over time, the behaviors will actually decrease. It's what we call an extinction burst. So there is a burst of more before the extinction phase, and it takes patience on the parents' part to know that even though things will get a little worse in the short term, in the long term, it's better. What's another strategy to use? Well, you can chart positive behaviors and then provide rewards for what you want to see more of. So how do you do this in a more effective manner? You want to focus on just a small set, maybe 2 to 4 specific behaviors. If you had a list of 12 things, that's just too much to try and work on all at the same time. You want to focus on what to do not what not to do. And again, very specific behavior. So your kid knows exactly what is expected of them. And you want something that has, particularly as you're starting, enough opportunities to reinforce. So if it's something that rarely happens, the kid won't actually have the chance to get rewarded. So there's really no, it's not going to be that effective because they're not seeing the reinforcement. Then you want to have what's called a rewards menu, meaning that it's, you have kind of things that the kid can work for the day. Like maybe it's, if you meet enough points for the day, then you would get 15 minutes of video games extra. And then maybe some weekly rewards, and maybe the weekly rewards are something bigger, like you get to choose the movie for family movie night, or if it was, maybe there's a small toy. It really can depend. It can be a lot of things, but you're essentially creating a system where you have opportunities to get points over time. And when you're doing well, you see that actually translate into things that kids want. Similar to the idea that our bosses want us to work, and so they give us a paycheck at the end of the month. And because they keep giving us a paycheck, we keep going to work. And then to implement the chart, you want to first focus on those high rate of success behaviors. Over time, you can switch out the behaviors. You don't have to be doing the same 2 to 4 behaviors at the same all the time. You know, you can work first on your easier targets and move over time to things that are more difficult. Make sure that you're prompting, monitoring, and praising the behavior still. And then make sure you really are consistent in your tracking so that kids do have that chance to get rewards. And this is what it might look like. So, you know, we'd identify a couple of behaviors like following directions at school, respectful language at home. We would track whether or not it happened, how many points have been earned, and then that would translate into that reward system. Now, a couple of pitfalls with this system is that if you're not mindful of looking at when this happens, a kid might feel like, well, it doesn't really matter because you don't even give me my points. So you have to be really careful about being mindful of tracking when this is actually when this is happening so that they have the chance to earn their points. When kids get their rewards, it can't be then taken away, or there can't be some big caveat that wasn't specifically listed to them up front that then they lose all the points that they had. They need that opportunity to be rewarded for their good behavior. It's okay to have points if you make up for bad behavior. Again, we don't want to take away their opportunity to earn what they did well, because then there's no incentive to keep trying the next time. Okay, and what if you wanted to learn more? Well, here's a bunch of again, different resources, no affiliation to us. These are just resources that I think are really helpful. Alan Kazun is one of the architects of one of the big behavioral management behavior parent training strategies. And so he's got a couple of books that can be really helpful, both for just general parent strategies, but also for more defined kids. A different approach that we didn't talk about today, but is called collaborative problem solving, has kind of a different slant on how do you manage for problematic behaviors. And that's Ross Green's model. So that could be if the first way doesn't work for you, that's kind of like an alternate. And sometimes just good communication at home is necessary. And that's where those how to talk to so kids will listen books can be really helpful. So I actually went a little quicker than I had planned. So I think we have plenty of time for questions. And I'd love to hear if there's any questions from the group.
Thank you, Dr. Badali. There's one question I can hear so far that says, are you aware of any software programs available for dealing with anxiety or relaxation or mindfulness?
So the Calm app is actually one that has some data to support, particularly for helping kids who are a little anxious around bedtime to sleep. Otherwise, there are other apps like that that can be helpful, both for some of the CBT strategies and for the mindfulness strategies. I believe it's the American Association of Depression and Anxiety that has a list of kind of all these different apps on their website, and they've rated them based on different characteristics. So not all of them are going to have the same support or the same kind of features, but it's like a helpful way of kind of navigating some of those.
Okay, great. I don't see any other questions. Oh, wait, here's another one. What do you think about the use of timeouts?
So the use of timeouts would fall into that list of consequences. So they can be very effective, but we want to use them sparingly. And kids need to know upfront what are the situations that might result in a timeout. Timeouts should be logical in their nature, meaning they're not forever timeouts. They're appropriate for that child's developmental age. And then when they've met their timeout appropriately, they're praised for having gotten through the timeout period.
I'm typing the answers. That's why I'm silent for a second. I also have, oh, sorry, go ahead.
Oh, I saw that there was a question. What would you recommend a child says to their parent or caretaker who they feel is not listening to them or is minimizing their feelings? So this is something where having a conversation, I think, beforehand, like what should we do if you're feeling like that? Like what can be a way of letting me know? Because we also, like my worry would be that the child says this to a parent and then the parent feels hurt and then it just causes this like really big cycle of a lot of negative affectivity. But if in a calm moment, when there aren't high emotions, you have a conversation and say, look, I think sometimes I might inadvertently say things that might make you feel like you're not heard or minimizing your feelings. I want to learn better when those times are happening, but I might not always be able to hear it well. So can we come up front with a way that you'll let me know? Maybe it's something as simple as you say, Mom, I think this is one of those moments when you're distracted to what I'm feeling, or whatever language works for you guys. But this way you have a really easy kind of like practice phrase. And when you hear that, you know, oh, I'm going to pause or something I'm not hearing. And then it'll be a cue for you to calm down. Okay, let's think about it and listen.
I have a question here that says, have you noticed the effects of COVID on teens specifically?
So unfortunately, COVID has had effects on everyone. And there's research to show that it has affected both young children, so in that early school age period, and teenagers in terms of their mental health. I will tell you, so I see kids clinically. There is a difference qualitatively to the kids that I see. They are not functioning as well as they used to be pre-pandemic. Now, obviously, this is just a very anecdotal experience, but it is well backed by research that on average, kids are feeling more stress, they're feeling more anxiety and depression, they're having more trouble sleeping, they're having more what we call somatic symptoms, those headaches, stomach aches, unidentified pains that would have no explanation. So across the board, it is not helping.
Mm-hmm. Yeah, not surprising. Yeah. Yeah, go ahead.
So someone put it, explain the drop-off routine. So this would be if it for kids, for instance, who are struggling with that separation anxiety. So we're really thinking particularly young kids show separation anxiety. So the drop-off routine would be, okay, we're bringing them to the daycare center or preschool, or maybe their elementary school, and maybe what used to happen is we would go all the way to their class with them. We'd have a long drawn out goodbye with lots of hugs and kisses, and we help them take off all their clothes. And that ends up not being effective because the drawn out nature of it doesn't help let the kid separate from the parent. So having kind of a clearer, okay, we're going to go to school. We're going to go to your teacher. Your teacher's going to take your hand and she's going to help you with all of this. She's awesome. Like, she is just such a great person. So like we're transitioning to a different routine that says the school is a great place, not mom is great or dad is great, because then we can't separate from mom and dad.
Got it. Oh, I have more questions here. Any suggestions for parents who have shared custody?
That's an excellent question. So whether whatever the situation is, when there's multiple caregivers, you want people to be on the same page in terms of strategies. And I'm thinking particularly in terms of behavioral problems. So if parents are kind of differentially reinforcing behaviors, you're not going to see the same consistent progress in that behavior than if you were consistently doing the same thing. And actually the same thing applies for if you can get the same strategies done within the school setting, because they're there for a lot of hours, you're going to see better outcomes long-term, because now everything is aligned to be working on some of those problem behaviors that you don't want to see as much and increasing the more positive behaviors. If we're thinking more about kind of the emotional distress piece, again, the same things we talked about would be good in one home are going to be really great in the other home. Now, this doesn't mean everything needs to be, sometimes this is a misinterpretation. People think, oh, every single detail in the two homes needs to be exactly the same. That is not what I'm saying. There can still be flexibility. There can still be differences in the way two parents parent. We're thinking about how do you address the big problems, like a kid is feeling a really high state of emotional distress, they're having significant behavioral problems. How do we address those pieces? We want very similar strategies. The other place where we're going to want more similarity in the two environments are kind of the things that help keep us regulated in terms of routine. So like bedtimes across the two homes, it would be really helpful if they're the same. Kind of healthy eating and exercising habits, helpful if they're the same across both environments. Again, because these are just about keeping kids well regulated, because if you're poorly regulated in one area, you're going to see lots of dysregulation in all the other areas.
Mm-hmm. Do you see the question in your chat?
Let's see.
Or do you want me to read it for you?
So do you have any tips for anxiety around going to the restroom? My son's 3.5 and asks for a diaper, but is fully toilet trained for urine. Oh, so this, I'm going to tell you guys, honestly, I don't deal with this as much. So I have limited knowledge, but there are, I know, some excellent resources out there in terms of helping kids with more toileting concerns. So in this case, with a 3.5-year-old, some of the ideas I have might be things like helping them express when things feel anxiety provoking, so that then you can see, like, is there something that you can do that maybe is distressing for them? And then really praising them for when they do manage to use the toilet, because then you're helping to reinforce the behavior that you want to see. Now, sometimes, and I'm not saying this is the case for this specific question, but sometimes kids have a lot of toileting concerns within kind of bigger patterns of neurodevelopmental problems. And one author that has a book on this is called Judith Kukavanis. And so that would be one resource to look for more toilet training suggestions.
Yeah. Thank you, she says. There's another in the Q&A that says, do you agree that the fallout our kids are feeling from COVID will last for generations to come? So
I think what researchers have predicted is that there's going to be some impact. It's not going to be the same for everyone. And for some, it might be almost nothing. And some for it might be more, and it can be in academic or emotional realms. And so if we're thinking from how do we help, let's take a prevention model, meaning that let's just put in the resources that are potentially needed. So if we think that kids might have more of those academic difficulties, let's address it now rather than wait to see years later that the problems have gotten massively big. If we think kids are feeling stressed now, let's give them the strategies to cope with stress now rather than have a cycle of not having good strategies for stress, and then it becomes bigger later on. So have you seen teens with ADHD struggling now as a result of the pandemic? So that's a really interesting question, because there is research suggesting that those inattentive symptoms in certain kind of aspects of the pandemic, like let's say that transition to a new way of learning remotely, or maybe you don't have the same consistency of teacher in the class, they can exacerbate those inattention symptoms. And so now you might be noticing more that a kid really had a problem because the difficulties they had are just kind of really showing themselves more. Another thing that can happen just in general is that kids who have a lot of cognitive strengths and have milder symptoms of ADHD, sometimes you don't notice that there's a problem for a while, and they get to adolescence and the demands on them are too much. And so what the pandemic has done is really, sometimes it's just revved up those extra demands a little bit earlier for those kids. And so you're noticing that they have problems, or it's just things are harder to manage because in general, they're harder to manage. So another person asked about dealing with constant bursts of anger and defiance, specifically for teenagers. So a lot of the same things that we've talked about. So first is identifying kind of like what level is this problem at. If it's really constant, that to me would say we need professional intervention to help. Don't think as a parent, this is all on you, because that you're just going to put too much stress on yourself to try and handle this with just a few like at-home changes. I would say seek out someone who is trained to really help you manage this aspect. Then what are some of the things that they're going to help you with? Well, first, identifying is there something underlying that? Very likely is. A good possibility, if there's a lot of these bursts of anger and defiance, is that the kid is feeling really depressed, really anxious, not in a good place, that they feel like there's too much on them. And so you're seeing kind of the overflow of emotion. They're on that like super high end of the distress scale. And so we're going to help with them with that emotional piece, with maybe, for instance, some of those DBT techniques that we talked about, like distress tolerance and mindfulness. On the more kind of like at-home behavioral side, you could also be working on some strategies there, especially if that anger and defiance is creating problems maybe for siblings of the kid. And so you just, even if you're targeting the underlying issue, you have to address the behavioral manifestations because it's having an impact on others. And again, that's where someone can help you have consistent ways. So I know sometimes the strategies I talked about, I was thinking of like younger kid examples, but the same ideas can be applied for older kids, just modified in the presentation. And a lot of what's done with teenagers is thinking about how do you improve communication with parents and teenagers, because when you have a better communication, you have a higher chance of addressing some of the problems.
Thanks, Dr. Badali. I have another question here. It says, it seems to me that cognitive behavioral therapy depends heavily on language. What suggestions do you have for a child with an expressive language disorder?
So there are, this is really going to depend, like how old is the kid who has an expressive language disorder? But let's imagine it's a slightly older kid, and so their language is potentially more like we would expect a younger child, there's modifications to cognitive behavioral therapy that are adapted for younger kids. And so a trained therapist would work on some of the simpler language. So you could still use CBT. That doesn't mean that's the only approach. There are definitely a lot of other approaches. So let's take the example of anxiety. That book that I had shown you from Ellie Leibowitz, it's actually called, the therapy is called Space. And it's to really target the anxiety through the parent. So it's almost like training you how to be a therapist because you're with your kid 24/7 or a lot of hours at least, versus the therapist would only be with them like 1 hour a week. And so by training you essentially to help them with it and not to, for instance, accidentally reinforce it, you're helping your kid with the anxiety. So for instance, for anxiety, for a kid who has an expressive language disorder, wouldn't be a good CBT candidate, but his anxiety, that space model might be like the perfect model for dealing with anxiety. And if there was other variations, you can feel free to let me know.
Right. I don't see it. Do you have any other questions over there?
Let's see if I've missed any.
I don't see any in the chat, but there may be some that were sent directly to you that you would see that I can't see.
No, I don't think so. Well, thank you everyone for all the really thoughtful questions. I appreciated being able to join you guys. And please do check out the ChildMind website. And our Healthy Minds project has a ton of free available resources that might give you an extra little pointer of where to go next.
Oh, I do see the last question, which I kind of forgot that usually it gets asked, is there any handout available after the meeting?
Yeah, so we'll be providing our slides that I believe Karen's gonna be able to email out to people.
Yeah, I will be emailing them out to everybody who has attended and possibly to those who missed it as well. Pam, go ahead.
I just wanted to say I'm putting in a link to the Healthy Minds Thriving Kids initiative that Dr. Badali just referenced. Again, these have free resources from videos to kind of downloadable worksheets for educators, caregivers. So please utilize them, also for created for children themselves. So this is a really great resource, and this is in English and Spanish. So please go ahead and utilize those resources. And that should be in there. And I can, of course, send this link again to Karen, Pam, and Sana, just to make sure that we can distribute it to the whole audience.
Yeah, if you could send that to me when you send the PowerPoint slides, that would be perfect. And I'll include that in the email.
Great.
Thank you so much. It's perfect. Pamela, are you able to turn on your camera? I'm not sure if it's me that's stopping you or if you're just not able to.
You're stopping me.
I don't know how to change it. I was able to before, and I can't see how to turn on your video. Oh, there you go.
I did it.
Okay, good.
There we go. I just wanted to say thank you, Lauren, and thank you, Dr. Baddeley. It was so wonderful to have the ChildMind Institute here with us tonight. It was very informative. The feedback we're already getting in the chat is that people found it very informative. I just happened to find the site accidentally, and I have to tell you, I was totally blown away by the resources that are on the site that are free for people to download, and their newsletter is incredible. I highly suggest that you connect. And I want to thank you very much for being here tonight.
I have one more thing.
Yeah.
I do appreciate you being here. I just want to talk about Montreal Center for Learning Disabilities quickly. We are a not-for-profit, and we're a charitable organization, and we rely heavily on government grants and memberships to offer these kinds of high-quality webinars. And so if you go to our website, there is a list of membership benefits, and I will include the link to the membership on the email that I send out to everyone. That's just an FYI.
Thank you, Karen.
Great.
Oh, you're
And
getting so
thank
many
you,
thank yous.
Karen, for your hard work tonight, too.
I like to call myself a glorified pencil pusher.
Okay. Well, I like to call myself Pam, so please do in the future.
Thank you
All
so much,
right.
everyone. We really appreciate it.
Okay. Thank you,
Thanks,
ladies.
everyone.
Have a great night. Thank
You
you
too.
so much, everyone, for attending.
Thank you.
Thank
Bye-bye.
you. Bye.